So viewers, today I'm going to talk about ABA. What is ABA is all about behavior modification and behavior intervention. Who are the interventionists and how they modify the behavior? Let's listen to Ms. Jawahar Alvi, who is a BCBA certified behavior analyst, and how she worked with the children.
My name is Jawahar Alvi. I'm a board certified behavior analyst and I am from Chicago. But I was born and raised in Pakistan till my master's. Then I got married and I moved to Chicago. And I've been working in the field since almost 2001, but in different capacities. So first I worked like as a teacher's assistant, but we had special needs kids at our center. And then after that, we had I worked at a high school because I did an MS in special education. We had extremely high behaviors. That's where I became like a BCBA after that. And then I've been working in the field since then. I've been in Dubai. We've had a clinical setting over there by the name of Rife USA. We catered almost 65 children but we worked in collaboration, because what we've seen is that until and unless we collaborate, we're not able to get the best outcome for our children. Same is over here in Pakistan. Now it's been a year that we've started BASES, Behavior and Special Educational Services. And what a behavior analyst means is that we work on skill deficits as well as we work on maladaptive behaviors. When people look at behavior analysts, they think that we only work with the maladaptive behaviors, but we don't just work with maladaptive behaviors, we also work with any kind of skill deficits. So anything that a child does not have, the way that we increase those skills is also a behavioral way of dealing with it. So that's applied behavior analysis, and that's how we work with it. As far as collaboration, I think that collaboration is extremely important, because if I am working on the verbal behavior of a child, I think the speech and language pathologist has a very important role in the articulation errors, in how to come up with the oral motor deficits, feeding therapy, swallowing issues. All those things can only be worked on with the collaboration of the speech and language pathologist.
Which population do you cater?
So right now we're working with autism the most in Pakistan, but in Chicago we are working with everything. So like in Chicago, I'm working with early intervention because I'm also EI certified, so I'm early intervention certified. I'm also working with, but when you say that I'm certified with EI, that means that I am looking at all children, not only autism in EI. It's like cerebral palsy, Down syndrome, autism, ADHD, any kind of mental illness. I'm looking at all children, but under 3 years of age. After 3 years of age, the health insurances in America, in the United States, they only cover autism. And then, but when we have 18 and above, then I'm looking at children or adults or adolescent that have any kind of behavioral issues, but they could be autism, Down syndrome, cerebral palsy. They could be having any mental illness like, schizophrenia, bipolar, dissociative personality disorder. I've worked with pedophilia. I've really worked with a lot of psychological disorders at this point. Everything with ABA. And dementia too. Oh yes, dementia, gerontology. So gerontology is also very close to my heart because we have like 3 family members who are very close to my heart. My own mother, my father-in-law, and my uncle who suffer from dementia. So that's really close to my heart, and I do work with it, and I've done a lot of research in that field also.
And we discussed about the role of reinforcement and the types and the importance of generalization.
So the question that comes to, which has been asked, is about reinforcement, and and it's a myth, I should say, that people ask me that, ABA to sirf jo hai wo kaam karta hai reinforcement se, but that's not true, because we do use reinforcement, which is one of the highly preferred thing that is used in ABA, but then we do fade it out. So for example, we work with tangible reinforcers, we work with social reinforcement, we work with any kind of sensory reinforcement, but then we fade those out. So these are reinforcement schedules that we work with. So for example, first we are going to give them reinforcement after a fixed interval or a fixed ratio, and then we fade it out to variable intervals or variable ratios, and then we go towards intermittent, which is the like very little reinforcement. Our purpose is to fade those reinforcements out so that the child is able to recruit reinforcement from their own environment, and all of our therapists, they are trained in that, because we want to make sure that the child is able to perform independently. Secondly, what we do is that we also work with generalization. So whatever we are teaching the child here, we make sure that the child is able to generalize it across settings, across people, across different times of the day. So for example, if we are teaching the child how to maybe label colors, we make sure that the child is able to label colors here and at home and in the community, and we train the parents how to do that. If we are teaching the child how to wash hands, we make sure that the child is able to wash hands here in the community and at home, and we train the parents for that. So this is generalization, and this is very important. Whatever we do over here, we give monthly reports to the parents, and the parents take those programs and they work with them at home. Over here, we give a structured environment to the child, and at home, I always ask the mothers and fathers to do it in a naturalistic setting so that all the targets, they are generalized and then they are maintained over time, because that is the success of a good ABA program.
And I asked her that how the collaboration affects the outcome.
So a couple of things I would like to say is that collaboration is extremely important. So अगर आपको कोई भी प्रोफेशनल आके कहता है कि जी आप ABA ना कराएं या आप स्पीच ना कराएं या आप OT ना कराएं, तो वो बिल्कुल गलत है, क्योंकि मेरे इतने सालों के एक्सपीरियंस में जो चीज़ मुझे समझ आई है और जो मैंने सीखी है वो ये है कि मैं आज तक एक स्टूडेंट हूँ और मैं आज तक अपनी दूसरी टीचर्स से सीख रही हूँ, और मेरी टीचर्स में मेरे ABA के प्रोफेसर्स भी हैं, स्पीच एंड लैंग्वेज पैथोलॉजिस्ट भी हैं, ऑक्यूपेशनल थेरेपिस्ट भी हैं, मॉन्टेसरी टीचर्स भी हैं, एंड एवरीबडी हु इज़ अराउंड अस इज़ माई टीचर. सो आई लर्न फ्रॉम ऑल ऑफ देम एंड आई कोलैबोरेट विद ऑल ऑफ देम, बिकॉज until and unless a child gets what he needs, the child is never going to make a progress. So we always have to give the child what he needs. So my motto is whatever works for the child is what should be given to the child. So we have to leave behind our biases and our egos, and we only have to work towards the betterment of the child. And for me, I've always seen that collaboration works best for the child. And the tip is that for the parents, I think that please educate yourself, please ask questions, and always advocate. Do not be in denial, because early intervention is the key to success to your child. The sooner you admit that, the better the chances are for the best results of your child. That's it.
Thank you so much.
Welcome.
Thank you so much. So now you got to know that how the behavior analyst and the behavior interventionist work with the children with autism and other have children with challenging behavior, how they modify their behavior and remove the unwanted behavior into wanted one, and how they improve their skills. The main thing to be noted is that this behavior intervention can be successful when the SLP and the behavior interventionists collaborate each other. We work on the behavior modification, and the main thing on which we work is antecedent modification. What is antecedent modification? Just to let you know that there is some antecedent, there is some reason of the behavior. We work on A, B, C. A means antecedent of the behavior, why the behavior occurs. B is behavior and C is consequences. When the behavior occurs, the consequences comes in front of you. So for parents who are having the children with challenging behavior, faces the problem and they are very stuck, very scared of the behaviors thrown by their children. Sometimes they throw tantrum in the public, sometimes they bite themselves. Then we work on the reason why they do that, and we work on that why. that is called antecedent. What is the reason behind that? There is some reason, like for example, if we are feeling hot, we need to switch on the fan. So the reason for that behavior to switching on the fan is that we were feeling hot, and then we switch on the fan, and the consequence is that the whole room is airy. So that is the ABC. All of us, we go through this ABC hundreds of times in our day, because all of us, we are having behavior, but they are not challenging, because we know the reason, we find the way to express it, and we find the way to solve it. But for that children who are having autism and ADHD and other problem issues, they are not able to identify the reason. So we have to work together on the antecedent to improve and to modify the antecedent of the behavior. The other thing is how to motivate to maintain the behavior. That is the more important thing than modification. When we modify the behavior, we have to maintain that behavior, and for that we have to train the parents. I think this episode will help you just to know about the behavior intervention and the main chunks of the science of the ABA. Thank you for watching.